driving pressure. So we spoke a little bit about driving pressure. So this driving pressure reflects the lung stress, and is strongly associated with mortality in ARDS. And then what's driving pressure? So driving pressure is the differences between the plateau pressure and the PEEP. So that difference between the plateau pressure and the PEEP, that's going to be the driving pressure. And like we said, how do we get our plateau pressure? Very good. So you have to do your inspiratory ode. So when you do your inspiratory ode, that will give you the plateau, because that already eliminates the what? Airway resistance. Very good. So that will give us the plateau. And that differences between the plateau and the PEEP. Remember, PEEP is positive and expiratory pressure. So that differences is going to be the driving pressure. And this driving pressure represents the pressure needed to deliver that tidal volume into the lungs, right? And what's the physiologic meaning of this? So this reflects the lung compliance, right? And the higher driving pressure, that means the lung is so stiff that we need a higher pressure to be pushing the tidal volume, to be delivering the tidal volume into the lung. So the higher the driving pressure, that means the poor the lung compliance, or the stiffer the lung is, right? And if the driving pressure is really high and we have to be applying a lot of pressure to drive or to deliver the tidal volume into the lung, then that could increase the risk of the patient for ventilator-induced lung injury. So think of changing pressure as how hard the ventilator has to push the lungs open, right? And our usual target for driving pressure, we want this driving pressure to be equal or less than 15. And a lower driving pressure has been associated with decreased mortality in patients with ARDS and also decrease in barotrauma. And as we know that our driving pressure is the change in volume, which is the tidal volume divided by what? Compliance. So if a patient driving pressure is too high, what are the changes that you can make on the vent to try to bring the driving pressure, to try to decrease the driving pressure? So you can decrease the tidal volume, right? Because if I go down my tidal volume, that could help to decrease what? The driving pressure. So that's one way, right? And then the other way is to try to improve the lung compliance. And one of the ways that you can improve the lung compliance is to recruitment with optimal PEEP. So you can go up on the PEEP to try to recruit the lungs and to try to improve the lung compliance. So that could be one way. So either coming down your tidal volume or going up on your PEEP. So that could help to decrease your driving pressure.